United Nations Population Fund says thousands of women in South Sudan suffer from obstetric fistula. A reproductive health specialist says too many child marriages is to blame for the highest rate of fistula cases in the country. Winnie Chirino has more for VOA from Juba.
Obstetric fistula is a hole between a woman's reproductive organ and rectum that is caused by prolonged obstructed labor, leaving a woman unable to control urine or feces. Dr. Samson Baba, Special Advisor to National Health Minister Riek Guy Kok, says fistula is painful and humiliating for women.
A lady who suffers from this will be having leakage of urine and feces, and in most cases, she's also rejected by the community and even husbands, and the communities normally shun them.
Dr. Baba says government hospitals have so far treated more than 1,000 patients suffering from obstetric fistula since 2011.
In 2015, 116 fistula cases were repaired in Wow Teaching Hospital. 2017, 123 were repaired in Yambio State Hospital, Awili State Hospital, and Juba Teaching Hospital. And in 2018, 141 were repaired in Wow, Mary Help, Wow Teaching Hospital, Awili State Hospital, Bentiu State Hospital, and Juba Lutheran Church. In 2019, 31 were repaired in Wow, St. Daniel Komboni Hospital, and Juba Lutheran Church.
Baba believes far more South Sudanese women and girls suffer from fistula than what is being reported, especially in rural communities. He says the government and aid agencies have been carrying out awareness campaigns since 2006 so that people understand the causes and symptoms of obstetric fistula. Citilina, a nurse in the gynecology ward at Juba Teaching Hospital, says the hospital has yet to register any cases of fistula this year. Speaking in Arabic, Lina says last year medical workers at the hospital treated young girls suffering from fistula as a result of rape, including a 5-year-old girl who was raped in Yambio and rushed to Juba Teaching Hospital.
Last year in April, we had about 4 cases of fistula. The majority were during birth, during deliverance that take longer time. That's when a mother does not deliver immediately. It is also common among young girls who give birth at 17 to 20 years old, and at times we also receive raping cases where 5-year-old girls are raped and also brings fistula.
Dr. Stephen Mauer, a reproductive health specialist with the UN Population Fund, says his agency has registered more than 60,000 fistula cases across the country, but it is more common among communities that practice early child marriages. He says fistula can disorganize one's normal menstruation cycle and may lead to infections that may cause infertility in the future. Dr. Mauer says fistula is repairable through surgery, but urges South Sudan communities to change their attitude toward child marriage in order to prevent the condition from happening in the first place.
If we don't address the root causes, we should not expect a reduction, because we are already talking about more than 60,000 women living with this condition. We are trying to treat, but the rate of treatment is not commensurate with the rates of new cases happening. So even when we are reaching the ones who are already affected, there are more people who are getting the condition. So we need to make sure that we focus more on prevention, like ending child marriage.
And Dr. Mauer says more antenatal care attendants must be trained, as well as increasing the skills level of health professionals so that when survivors visit a hospital, they can get medical support. He says UNFPA is working with other stakeholders to enact policies that regulate reproductive health care practices and rights in South Sudan.
The issue of family planning in terms of correct birth spacing, getting pregnant at the right time, not having too frequent deliveries, proper spacing, not having pregnancies that are too risky, like maybe at an older age where complications of fistula can come in.
Mauer says UNFPA provides contraceptives and maternal medicines to South Sudan hospitals. He urges parents to keep their daughters in school so that they can avoid early child marriage and early pregnancies, and urges communities to make sure that women deliver babies with the help of skilled birth attendants. The theme of this year's International Day to End Obstetric Fistula is a human rights violation. End it now. For VOA News, I am Winnie Serino in Juba.
That's our show for this Thursday. We now leave you with the song Kelele by Hard Life Avenue Stars.